Hello everyone, myself Dr. Prateek Garg, your ENT tutor. Today we will discuss about sigmoid sinus thrombophlebitis. So by the name itself suggests it is an inflammation and the thromboembolic event happening in the sigmoid sinus. So where is the sigmoid sinus present? Suppose this is my external auditory canal and this is my mastoid bone. So sigmoid sinus is just posterior to the mastoid bone. So because of the continuous infection in the middle ear structure or ongoing cholesteatoma or unsafe type of CSOM, so it will lead to the thrombophlebitis of the sigmoid sinus, leading to thrombus clot in the sigmoid sinus, engorgement of the mastoid emissary veins which are connecting in between the mastoid and the sigmoid sinus. So what is this? It is a complication of acute coalescent mastoiditis or CSOM or cholesteatoma which will result in thrombosis and inflammation of the sigmoid sinus. What are the typical clinical features? The first one is the Pickett-Hens fever. So it is generally pathognomic of the sigmoid sinus thrombophlebitis. What is particular about Pickett-Hens fever? So there will be sudden rise in the temperature, that is sudden spike in the fever. The patient become very warm, then suddenly the temperature becomes normal with a certain duration of the time. And after some time again patient will have fever with the increased temperature and again he will become normal. So there is some sort of spikes in the fever suddenly going up and then coming back to normal temperature. It's not a continuous fever. So why it happens? Every 8 hourly, 7 to 8 hourly, some of the microemboli they will just release in the blood. Okay, that will result in sudden spike in the fever leading to typical Pickett-Hens fever or also known as spiky fever or hectic fever, which is a pathognomic feature of sigmoid sinus thrombophlebitis. Now there is one sign present in this which is known as Griesinger sign. What is this sign? Because of the thrombophlebitis, there will be the edema and redness present over the posterior part of the mastoid. If the patient is having this sigmoid sinus thrombophlebitis, so posterior end of the mastoid will be having some bluish discoloration, some reddishness, and the edema is present. So that is also helping in diagnosis of sigmoid sinus thrombophlebitis. And why does it happen? It happens because of thrombosis of mastoid emissary veins. Okay, and other features will symptoms will be present like papilloedema. Now, if we do the CT scan, that is contrast enhanced CT scan in a patient of sigmoid sinus thrombophlebitis, so we can appreciate the typical delta sign. So again, very important for the examination point of view. So contrast enhanced CT scan will show the typical delta sign, and if we do the non-contrast CT scan, there will be empty delta sign. We can also go for the contrast enhanced MRI. Now let's talk about certain signs or tests in the sigmoid sinus thrombophlebitis. Look at this diagram. You can see some sort of bluish discoloration over the posterior part of the mastoid. So this is typical of what? Griesinger sign or sigmoid sinus thrombophlebitis, which we have discussed. Now, one of the important tests what we can do is Tobbe-Ayer test. See, in sigmoid sinus thrombophlebitis, suppose the patient is having right-sided sigmoid sinus thrombophlebitis. So if we do the compression of IJV, that is the internal jugular vein, if we compress the IJV on opposite side, that is over the healthy side, so that will result in increase of CSF pressure. If we compress the IJV on the same side, there will be no increase in CSF pressure. So this is a test by which we can diagnose that in this side there is a thrombophlebitis, where over the opposite side, if we compress IJV, the CSF pressure will get increased. So this is known as Tobbe-Ayer test. Another test is Crow-Beck test. In this, what we do, again, we will put a pressure on the IJV over the healthy side, and this will result in engorgement of retinal vein. So look at the retinal vein by means of an ophthalmoscope or some other instrument. So we can see the engorgement of retinal vein if we put the pressure or compression over the IJV. So this is known as Kruvax test. These both tests are important, has been asked in the previous paper. And there will be tenderness over the jugular vein.